Bună ziua! Astăzi avem alături de noi un invitat deosebit. Este vorba despre Dr. Masahiro Ono, cercetătorul japonez care a inventat tehnologia Toki. Această tehnologie ne-a permis pentru prima dată în istorie să analizăm cum se exprimă genele în timp real, în vivo. Urmează acum să avem împreună cu el o discuție liberă despre situația actuală în România în ceea ce privește această pandemie. What about children under 16? Right now, more and more studies are being done. What do we think is best when it comes to very young people?
So when talking about the young people for vaccination, I understand that there are two lines of arguments. One is to protect children from coronavirus, severe disease. Another is to protect children from infection so that the pandemic can be controlled. And now we've learned that the coronavirus, the vaccine, the immunity induced by vaccine is not permanent. So it can decay slowly. So therefore, probably we shouldn't think about getting children vaccinated for the general population to be protected. We should think about them, whether we can protect them, protect their health by vaccine. Then now we need to go back to the risk and benefit calculation. And for children, young children, this is not extremely obvious problem. So it's because the risk of developing a severe disease is very low among children. But the risk of developing an adverse effect, such as myocarditis, is also not high, as we said. So this means that both the risk and the benefit are very low. And this means that we need to have a very good statistical data to make a conclusion. And my understanding is that overall, the benefit is still greater than the risk, even among young children before teenage. So in many countries, including the States and Japan, the children's group, the age group, is encouraged to get vaccinated. The UK is taking a more cautious approach, but still they are slowly encouraging children to get vaccinated after understanding the vaccine by themselves.
Are they also considering the fact that getting the vaccine would prevent young children from spreading it to their potentially more vulnerable parents?
Yes, in some situations, yes. So because children's welfare is dependent on their family, isn't it?
Yes.
And if their family includes a person who is very much vulnerable to the infection and may develop a severe disease if contracted the virus. So there's a clear guideline in the UK. So children in this age group with a family member who has a great risk of developing a severe disease are recommended to get vaccinated.
Is there a reason to believe that natural immunization might be superior to the vaccine?
Definitely not, because it is very clear that natural infection gives a lot weaker and a lot more unstable immunity to people than vaccination. So this may sound a little counterintuitive, but there are a lot of evidence supporting this principle. So basically, even if you get the virus, contract the virus, and develop a coronavirus symptoms, you are recommended to get vaccinated in many countries. So this is because natural infections, the immunity induced by natural infection cannot last more than several months, while the immunity given by the vaccines can last a lot longer and gives a lot more stable, robust immunity.
Is it because the virus has immune evasion mechanisms? Is it because people who get the infection don't necessarily produce neutralizing antibodies in response?
We don't know yet the exact reason, but there are the things you right now pointed are one of the possibilities. Probably, yes, the virus has an active mechanism to escape the immunity, which may contribute to the quick decay of the immunity established by natural infection. Also, it is possible that vaccines are very efficient to induce antibodies and the T cell responses, the immune responses to the virus. And because the effects are so good, so that the starting point is a lot better, so that the immunity lasts long. But anyway, so this is one of the most remarkable features of the coronavirus infection, and we still need to study.
If we keep getting a vaccine every 6 to 8 months for, let's say, 2, 3, maybe 4 years, could this pose any risk in terms of our immune system for our body to keep seeing the same antigen periodically?
We still don't know how much the immunity decays after the third dose. And we don't know how many months the immunity given by the 3 doses can last securely. So to be honest, we need to see how it goes after the booster dose, the third dose. And of course, it is another issue to be addressed, whether it is safe enough to have multiple doses over years. And this needs to be addressed by clinical trials. And I understand these efforts have been always done. And now people are being prepared for the third dose. And we will have to carry on those efforts. But eventually, the idea, I believe, will remain the same. So we need to seek the best approach for the people to maximize the benefit and minimize the risk.
So before we consider giving the third dose to the entire population, maybe it would be safer to have a proper clinical trial concerning the third dose, and for now just to give the first 2 doses and focus on that.
I think that the third doses have been already given to quite a lot of people, which has been a trial, and so far no significant issue is observed, so we can safely proceed with vaccinating the most vulnerable by the third dose. And now, obviously, we have to calculate the best timing for people to get the third dose. And such a precise calculation may need a clinical trial to see how we can protect people, how the immune system can give an enough strong response to the virus by 1 to 3 doses, basically in the coming year in many countries.
When this pandemic first broke out, a lot of research has gone into the subject of the coronavirus. A lot of labs have prioritized this topic. And I was wondering, have perhaps other areas of research been affected by this, by the extra funding that went into coronavirus research?
I think that in terms of research, you don't have to worry about the stagnation of other areas. The response of the scientific communities to the pandemic has been extraordinary. So we have had many positive things about sharing the data and cooperate with other groups to achieve the quickest and the most effective response to the pandemic. And we've learned that it is possible for human beings to develop such an effective vaccine and treatments as well within only 1.5 years since the pandemic. So this is extraordinary. I think we should just appreciate this achievement.
Definitely.
Yeah, this gives us another thought. It gives many people another thought. Then we are now successfully. We haven't solved the problem completely yet, but still we have been successfully addressing many big problems of the pandemic. Then you can imagine people with different diseases are now hoping to have such a miracle occur in their fields. So, and the key thing has been the collaboration and transparency. The data are shared and people collaborated. And this has made it possible that the scientific communities worldwide worked together to find solutions to the pandemic. And this is happening right now. And we still need to make a lot of efforts before the pandemic is completely over. But many people more confident and more optimistic about the future of human being in terms of the pandemic. And we should carry on this to tackle with other diseases as well.
That is a great point. Maybe this will hopefully serve as inspiration for people to collaborate in other fields as well to this extent. If we did this for cancer research next or for multiple sclerosis, perhaps we could make giant leaps from now on.
Yeah, exactly.
So what are we missing for this pandemic to finally be eradicated? What do we still need in order to see the end of the tunnel?
It's about when is the pandemic finished. That's all. And then we should think about what is the pandemic? What is the problem? Yes, if we talk about the central problem again, so the central problem is in that hospitals are overwhelmed by a sudden outbreak of infection. Then people would not be able to be seen properly by doctors or nurses. It's not just about coronavirus patients, but also patients with trauma, injuries, cancer patients who are waiting for operation, and many other difficult diseases which should be immediately treated, can't be properly treated if hospitals are overwhelmed. So the question is about when we can completely prevent this happening. And the vaccines are great. So this is really an effective weapon we have. So we can greatly reduce the number of people who develop severe disease, and the vaccines can prevent infections as well in many people. So, but still, this is not a perfect treatment, perfect solution, because firstly, even if the vaccine effectiveness is more than 90%, 5%, 10% of people may get hospitalized by a severe disease even after vaccination. So this means that if the infection is just spread, let's say 10 times more, then eventually we will have the same number of people, patients, hospitalized in this situation.
Social distancing measures, wearing face masks. Do you think we'll have to do that for the foreseeable future?
Yeah, so talking about social distancing, yes, it is clear that a measure which can be easily done will not harm anything. For example, by having a face covering mask will not prevent you from doing anything substantial. Other measures, social distancing, sometimes restricting the use of room space, restricting the use of workspace, etc. So any such measures will have some significant consequence. So it's not free, basically. Therefore, we should really think about a strategy carefully while carefully analyzing the coronavirus impact on hospitals and other sectors. So saying this, once if the impact of the infection is reduced by vaccines, it will become a lot easier for people to control the pandemic, the infection. Then this means that people will not have to do severe restrictions in their life, in their work. But this doesn't mean that every measure will be gone immediately, because as we discussed right now, vaccines will not eliminate the virus completely. We will still have to be with them, which means that to optimize vaccine programs would be important. Also, it will be important to effectively use treatments and develop new treatments so that people would not develop severe disease even if they contract the virus. And we think that after having those proper measures, medical measures to protect people, we will less rely on such social measures to restrict people's life. And eventually, this will go to the point where we feel that the pandemic is over.
Thank you, Masahiro, for your words. Thank you for your time and for sharing your expertise with us. It was an honor to have you here. And we hope that this pandemic will bring good things for progress in science and that we will overcome this together.
Thank you very much. And very nice to see you today.